Here are the key findings. A total of 94 and not 36 mentally ill patients have died during this process. 94, not 60, not 80, not 87, whatever you read in the Sowetan was wrong. It's 94, and this, I call it a provisional number. The reason why I call it a provisional number is because there are other agencies that are investigating this process, like the South African Police. They are still investigating. There are corpses that are still in mortuaries that have not been identified, and we don't know whether they form part of this. Not all the information we could get from the NGO was often full. Some of them were actually reluctant to give information. And some families are now just coming out of the woodworks, sending us names of their relatives that they want us to investigate. So I suspect that the number, it's higher than that, and that's why I have entitled my report 94 silent death and still counting, because the counting will obviously outlive my report. And I want to emphasize, this is a provisional number that keeps on changing as more people are obviously counted. The second major finding is that all the 27 NGOs where patients were transferred from Life Esidimeni have been found to have been operating under invalid licenses. In short, I'm saying that the Gauteng Department of Health took mentally ill patients from a licensed institution and put them into 27 unlicensed or NGOs that operated with invalid licenses. And you can see how unlawful that must be for a provincial department to do that to a group of vulnerable people about whom we must actually take the utmost care and look after. So 27 of those NGOs were unlawful, and therefore anybody who died in those circumstances died under unlawful circumstances. It's that simple. Now, the next finding is that 80% of the deaths occurred in 5 complexes. 5. Now, if you wanted to say that people died because it was winter, I kept on asking people, did this winter just only visit 5 places in Gauteng? And nobody could answer that. And those places are CCR, the Cullinan Center, Rehabilitation Center, together with these NGOs called Siabadinga and eNCA, where 25 of the mentally ill patients died. There was Musiho, and that works with Takalani, where 15 people died. There was Tsepong, where 10 people died. And then there was a place called Hefsiba, where 5 people died. So, and there was Precious Angels, where I think 20 mentally ill patients died. So 80% of the death occurred in these 5 places. And remember, there are 27 NGOs. So let's not live here with the message that every NGO is painted with the same brush. It's only painted in the same brush that they are all unlicensed. But in terms of death, 11 of them, there were no death. And I think we must just recognize that.